And now we continue our work with the agenda item 5F on action plan to improve public health preparedness and response in the WHO European region. The relevant document is Euro/RC68/14, and the draft resolution is contained in Euro/RC68/conference document /5 revised 1. Financial implication can be found in document Euro/RC68/14 edit 1. The regional action the Secretariat informed me that there is a mistake in the Russian version in the conference document 5, preambular paragraph 4, concerning the translation of welcomed with appreciation. This will be corrected in the final version of the resolution. The regional action plan to improve public health preparedness and response in the WHO European region is built upon the 5-year global strategic plan, which was welcomed with the appreciation at the World Health Assembly 71 in May 2018, and the accelerating implementation of the International Health Regulations 2005 and strengthening laboratory capacities for better health in the WHO European region we discussed last year. There has been extensive consultation, including a high-level meeting in February 2018 in Munich, discussion at the Standing Committee, an online web consultation in June 2018, and numerous bilateral exchanges with member states and other stakeholders. Let us not forget the aim of this action plan: to ensure that in our region the impact of emergencies on health is prevented or minimized. Before we start our discussion, I invite you to watch a short video. Please.
When we talk about the capacities to respond to health emergencies, I think the work should be done between the crises, because I think we're all sure that the next crisis will come in public health area, but it depends when and how we will be prepared.
Strengthening health systems and building resilient health systems help us to respond fast in an outbreak, and it helps to prevent outbreaks. So therefore investment in prevention is, from our perspective, extremely important.
Because IHR is a legalized framework, it has forced us to renew laws, establish institutions, and really make the One Health, All Hazards approach the law of the land. So we have institutions working together across the fields, and we believe that it's really a true implementation of the health in all policies.
Медико-санитарные правила лежат в основе безопасности здравоохранения.
I think the IHR was in a way a wake-up call. It helped us structure our inputs, so I think that has definitely been of great help.
What have helped us is to build better communications with the region, because what we see is helpful in IHR is the communication and timely communication of any events.
Germany is a federal state, and we have a lot of challenges to cope with the 16 Länder in Germany. We have to find ways for a good communication, for a good cooperation, and the IHR helped us in this regard.
One of the primary important aspects of IHR is the information sharing, the 24/7 surveillance network that exists all around the world. We cannot build walls to protect ourselves, so Therefore, we need to have information to be able to be ready.
Well, I think that one of the main issues has been the cross-sectoral collaboration within the country.
We believe that the WHO Europe office can help countries in improving their health systems and preparedness capacities.
I see the coordination function of WHO as very vital, both in the European region as well as globally.
WHO is kind of watchdog to implement IHR and to keep multilateralism in this area.
Сказать, что роль ВОЗ в чрезвычайных ситуациях в области здравоохранения имеет решающее значение, и она призвана помочь странам работать сообща в целях защиты жизни людей, которым угрожает распространение болезней и других рисков для здоровья.
WHO Europe can support countries in building the core capacities. It can help countries to build partnerships, to be better prepared for future outbreaks, and in case of an emergency, it could coordinate all the activities.
All our efforts are to save people from any health threats. We definitely want to listen to you, particularly in our plans in the region to strengthen WHO's efforts to build the capacities, which is going to set us as strategic pathways for the next 5 years.
Thank you. I will now ask Dr. Nedret Emiroglu, Director of the Emergencies and Communicable Diseases, and Dr. Dorit Nitsan, Coordinator for Health Emergencies, to introduce this agenda item. Please, Nedret.
Thank you very much, Executive President. It's a pleasure to present you the work of and the proposed Regional Action Plan on Public Health Preparedness and Response within the WHO European region, together with my colleague, Dr. Dorit Nitsan, who is the Coordinator on Health Emergencies in the regional office. I need to go one back. This is not the right slide set. I'm very sorry. Yeah. One back, please. Yes. That's the slide I wanted to start. Apologies for the technical problem. So what was the reason for having an action plan? You have watched the video, actually a number of interviews being done. I'm happy to see that most of you are here in this auditorium. And you have been asking WHO to take a lot of leadership role. The region has a number of challenges related to health emergencies. It's including epidemiological and different risk profiles, health system maturity, and other factors that influence the health emergency preparedness and response capacity. So recognizing that full protection against health threats requires high-level political and financial commitment and a coordinated and systematic approach, taking the full emergency management cycle and also engaging multi-sectorial, all the government structures at the national and local level. This requires a concerted action plan, which has been the basis of presenting you this regional action plan. We have a vision that we would like to share with you. It's a region where the impact of health emergencies is prevented or minimized. And we think this could be done by really focusing on the core capacities that is needed and strengthening those capacities to be able to prevent, prepare for, detect on time, and respond again adequately and timely to all public health threats effectively. In addition, WHO is committed to provide assistance to the affected countries in partnership, in a broad partnership when necessary. I just wanted to give you the timeline of the work we do. I need to go back to the slides. The first slide, please. Yes. I just want to remind you the time frame. And going to the slide, on the upper part, you see the time frame on what has happened globally. And in the bottom part, you see what has happened in regionally. And I'm not going to go back. IHR implementation has been extremely efficient during the more than past 10 years. And last year at the regional committee, we have presented you a regional vision again to accelerate the actions within the region, European region, until we have a discussion on a possible regional action plan this year. And following the World Health Assembly discussions and on the 5-year global strategic plan, we are now presenting you the proposed regional action plan. And I'm happy to give the floor to my colleague Dorit Nitsan. Just want to mention that this is a product. This is a common joint product with you and the partners. So because it has gone through a very broad consultation, and I hope you will have the full ownership. Thank you.
Thank you, Nedret. Chair, honorable delegates, ladies and gentlemen. I'll just jump directly into the topic and continue from what Nedret just ended her part. Yes, we work together. We really work together to produce the first draft of this action plan and the resolution. It started during the high-level meeting that we held in February 2018 in Munich, with thanks to Germany. And the first draft was presented to the SCRC. It was then presented for a member state's web consultation and to the European Commission. 36 member states and the EC provided their concrete input. In the web consultation, we can see that there were some main comments that kept coming. There was a general agreement that the development and launch of this 5-year plan is highly urgent and timely in order to improve preparedness and responsiveness for the public health and of the public health sector. Some countries highlighted the importance of aligning the plan and the preparedness planning with the EU tools and the EU, for example, 1082. This was also taken into account. One country provided concrete comments and efforts were done in different hours just to listen and accommodate them as possible. Some highlighted the importance to ensure financial and political commitments to implement the proposal, and that just shows why the resolution is so important. And indeed, the resolution and the action plan is our joint product. The action plan that is presented and the resolution for today are our common product, and this is one of the teams and the meetings that we held in order to discuss it. Oh, what is going on? It's jumping. Sorry. Something is wrong with the presentation, huh? It stopped. Who is, okay. We were here, and it stopped. Okay, I will just quickly go through without the slides. It's okay. Somebody is moving it. I don't know. It's not with us. Let me just go quickly, not to take your time. So we used guiding principles, and these guiding principles served us through the whole process. The first one was to build on the global strategic plan to improve public health preparedness and response from 2018 to 2023. The European Action Plan recognizes the interdependence of the whole process, but also with the strengthening of health systems. So those two issues were the first ones. The action plans also adheres to the framework and the principles of the IHR. It's an important one. It strives to contribute to the achievement of the commitment to the SDGs, to leave no one behind through the promotion of universal health coverage and complies with existing international health policy frameworks. The action plan also recognizes the fundamental importance of country ownership. This is important. Country ownership that focuses on a need-based approach on the requests from the countries and on the domestic sources of fundings in order to ensure sustainability. All preparedness and response strategies and actions undertaken by state parties should be based on relevant national and, if applicable, on intersectoral collaboration. We mention it and we again let it be under the country's ownership. The action plan emphasizes leadership role of WHO in guiding stakeholders to support countries in capacity development. And last but not least is that the priorities WHO support is actually focusing on set of priority countries in the WHO European region, and focusing on these countries is making us very well prepared in the European region for all phases of the emergency management cycle. The action plan is built on 3 pillars, and these 3 pillars are the very important ones. The first pillar is to build, strengthen, and maintain state parties' core capacities that are required under the IHR. Here, we are talking about details like national policies, IHR coordination, etc. Detailed plan that Pillar 1 provides to us. The second pillar is strengthen event management and compliance with the requirements under IHR. It is an important aspect of the action plan, as it emphasizes the response and the operations also, and not only the preparedness. So the event management and compliance under the IHR are emphasized here. The third pillar is to measure progress and promote accountability. This one is important as well, because here we emphasize the obligations under the IHR, state annual parties reporting, the annual reporting to the World Health Assembly, and this obligation is a must. When we analyze the information there, this should lead for a concrete plan that is country-specific to strengthen their capacities. Of course, we also have available assessment of capacities through the use of voluntary tools that could kind of strengthen our assessment. So the draft resolution that we are presenting for adoption of the regional action plan is the one that is considered as a joint tool for all of us. It is calling for all of us to accept and to support each other, and using the 3 pillars as prescription for action. We thank you for your impressive engagement through the whole process, and for this, we look forward to your interventions and for successful implementation. Thank you very much.
Thank you very much, Nedret. Thank you very much, Dorit. Let me now open the floor for the discussion on the document and the relevant resolution. I would like now ask delegates wishing to speak to raise their nameplates, please. Macedonia first. Then second. Okay, Serbia. Thank you. I would like to ask distinguished delegates to keep your interventions to 3 minutes so that all those wishing to speak have the opportunity to do so. We would like to start the interventions by former Yugoslavian Republic of Macedonia, followed by Serbia.
Thank you very much, Mr. President. Dear Chair, dear Emergency Team, dear colleagues, because the Republic of Macedonia is a presidency with Southeastern Europe Health Network and the absence of delegation of Israel, I will present a statement on behalf of State of Israel. Israel is applauding World Health Organization emergency program in general and the European region in particular, working on the full emergency cycles with World Health Organization at the leading role and with partners will make the impact that is needed to implement the general program of work 13 and will lead us to fulfillment of Southeastern Europe. The guiding principles of the action plan are setting the basis for the activities. Israel has been supporting the Euro and global activities in emergency preparedness and response through the emergency medical teams, WAL and HASBART, as well as emergency care systems. Together with World Health Organization for European region, we have been training generation of public health professionals in public health emergency management. We have collaborated centers that work closely with you. We seconded high-level staff and have interns in your country, hubs and regional office. We endorse and accept fully the resolution and action plan and are ready to continue our collaborations. We are thankful and support the resolution and look forward to implement it together. We would like to have a joint external evaluation and are to your service. Thank you. In behalf of the State of Israel.
Thank you. I would like to ask delegate of Serbia, followed by Russian Federation.
Thank you very much. Your Excellencies, dear colleagues, thanks to the strong WHO support, also thanks to the EU pre-accession process and European Center for Control of Communicable Diseases, in the past few years, Serbia's preparedness for public health emergency events has been improved, structured, and it is better organized and also based on experiences from floods, unfortunately. Ministry of Health, together with the Institute of Public Health, is finalizing the National Health Emergency Preparedness and Response Plan with WHO support. More than 1,300 public health workers, as well as representatives of relevant authorities, institutions, and organizations at local level, have already been trained in preparedness and response to public health emergencies. By hosting the WHO Emergency Program Hub for the priority countries in our sub-region, Ministry of Health initiated and now is in the process of joint evaluation, external evaluation. In regards to the West Nile fever, Serbia has been facing with seasonal outbreaks every year since 2012. This year, situation seems to be the most difficult, and as of September 11th, a total of 286 cases have been confirmed with 29 deaths. Ministry is working with all stakeholders and the key control measures have been implemented so far. However, some of the challenges still have to be addressed with WHO support in order to provide adequate and effective vector control measures, such as revisions of the vector control strategy, development of the preparedness and response plan, and coordination mechanism at national level, development of the risk communication plan, as well as further strengthening of the national capacities at the tertiary, secondary healthcare level that are in line with the European framework for better surveillance and response on vector-borne diseases. Thank you very much.
Thank you. Russian Federation, please, followed by Republic of Moldova.
Thank you very much, Chairman. Chairman, ladies and gentlemen, the Russian Federation is speaking on behalf of the countries of the CIS as well, the Republic of Armenia and the Republic of Belarus. Introduction of international health regulations plays an important role in ensuring preparedness for and rapid reaction to health emergencies. Supporting the independent coordinating role of WHO in this respect and working together with member states is extremely important in tackling major public health emergency response. The level of preparedness for and response by health systems in the European region is covered in the document, which tackles a wide range of issues, including the IHRs, and takes into account the strategic directions of the recommendations via the IHR to countries. The draft plan of action includes provisions, however, which do not enable us to accept the document as it is currently reflected in the draft resolution. First of all, there is no reference to the work of the WHO's regional office with the partners, and it seems that the definition of partners is not clear. For example, coordination of the WHO regional office with unidentified partners is encouraged, and in respect of assessing the readiness of countries to respond to and tackle health emergencies. We believe that this, especially involving key partners, is something that should be done only at the request of member states of WHO, and we also think that WHO's coordinating role should be guaranteed. Secondly, there have been discussions and consultations, but there should have been more. Not all the proposals made by member states or the concerns expressed by them have actually been reflected in the draft plan of action. Furthermore, some countries have expressed concern about the improvement of monitoring and assessment, including external assessment. There's also an issue of financing to be dealt with. We believe that any assessment on the preparedness of countries to react to emergency situations and the use of voluntary instruments is going to run counter to other provisions and decisions taken by the governing bodies. We believe that the self-assessment mechanism under the IHRs needs to be looked at again. And there are certain legal instruments that need a decision to be taken by the World Health Assembly, as indicated in the rules. Under the plan of action, the provision of information about the monitoring system and the various technical areas is not clear. We believe it is essential that we need to look at the mechanism again and discuss its character, taking into account the opinions of all member states, and that's particularly important when initiatives are being suggested which are not in the interests of all major states. Therefore, the Republic of Armenia, the Republic of Belarus, and the Russian Federation believe that the draft plan and the resolution need further work. We have amendments to the draft resolution that we would like to table in order to try and get consensus agreement. Thank you.
Thank you. I would like to ask delegates of Republic of Moldova, followed by Azerbaijan.
Thank you, Mr. Chair. Madam Regional Director, dear colleagues, thank you for developing and presenting document advancing public health for sustainable development in the WHO European region. We which we fully support. The Republic of Moldova is pleased to see that this document promotes understanding of the inevitable limits of individual health care and of the need to complement such services with effective public health strategies. More improvements in population health will also come from action outside health and medical care. Besides controlling communicable diseases, eradicating environmental hazards, improving population.
Could you please slow down? Thank you.
The availability and quality of effective health care, action is needed on working condition, education, transport, and all other sectors that offer many opportunities to improve health and well-being. To achieve this, every country needs a cadre of knowledgeable public health practitioners with social, political, and organizational skills to lead and bring about changes at international, national, and local levels. Much of modern public health is about tackling strong vested interest head-on, empowering people so they can make healthy decisions, and recognizing the political nature of this issue. Health is a political choice. The essential public health operation assessment conducted in Moldova in 2011 resulted in a report with recommendations that informed the draft of the National Public Health Strategy and Action Plan for 2014-2020, which has been shaping the public health reform agenda. Moldova Ministry of Health and Labor and Social Protection launched with the WHO support public health reform in the Republic of Moldova, which started with the reorganization of public health laboratories in 2016. In 2017, with WHO support, the working group finalized the public health reform concept, including the modernization of operational setup leading to public health service reorganization and restructuring in early 2018. This process is well underway with the WHO technical assistance. With regard to enhanced investment in public health, the bottom line is that given the current quite limited fiscal space in the Republic of Moldova, more funding of public health could be secured only through effective gains in the rest of health systems. Ongoing health system reforms are contributing to the overall streamlining of health expenditures and are generating cost saving while maintaining access to service and quality. It is important to keep those savings within the health sector and channel those to priority public health intervention. We are aware that implementing the 2030 agenda and a recommendation from the document Advancing Public Health for Sustainable Development in WHO Europe region will require strong political commitment, national ownership, and good governance, robust planning and delivery mechanisms, sustainable financing, strategic partnership, engagement with society, and shared accountability mechanism. We recognize that health and well-being are the final outcome, but also the determinants and enablers of SDGs. We recently committed to carry out ongoing public health reforms and implement 10-point action plan stipulated in document Advancing Public Health for Sustainable Development in the WHO Europe region. In doing that, we are very much rely on guidance and technical support provided by development partners and WHO. The Republic of Moldova supports adoption of the document and advancing public health for sustainable development in the WHO region. Thank you.
Chairman, good afternoon. These are your interpreters. Since delegates are making prepared statements that we do not have in advance, could we please ask them to speak more slowly? Thank you very much.
I would like to ask the delegate of Azerbaijan, followed by Turkey.
Chair, colleagues, firstly, allow me to thank the Secretariat for having prepared a draft resolution for us. In recent years, creating high-level capacity for public health preparedness and response has been prompted by the fact that we have needed to take measures to respond to public health emergencies. And this has become a particularly relevant issue for all of us in the era of globalization and increased migration. We recognize then that it is essential that we can all take high-quality, properly prepared measures when required in order to allow countries to respond to public health emergencies of international significance. And we therefore also recognize that we have to develop laboratory capacity and to create a properly functioning high-level IT network. We and our partners have created a central reference laboratory for infectious diseases, and there are other measures and means available to us. For instance, we have introduced an electronic surveillance system, and this is something that has helped us to take decisions when required in the shortest amount of time and without having to spend excessive resources. We target our resources appropriately. We recognize then that information exchange is a vital part of the whole series of measures that have to be taken both at country and at international level to respond to such emergencies, and that being so, we support the draft resolution. Thank you.
I would like to ask delegate of Turkey, followed by Finland.
Thank you very much, Mr. Chair. I thank the Secretariat for the draft action plan to improve public health preparedness and response in the WHO European region. Turkey welcomes the action plan enables full implementation of the international health regulations. Since well-functioning health systems are key to achieving global health security and universal health coverage, and well-functioning health systems need well-organized international legal frameworks such as IHR. I'd like to emphasize the importance of IHR from a public health perspective and its legally binding nature. All member states have a responsibility for the health of their own population by developing their health systems' capacities for prevention, detection, preparedness, and response. We also have an international responsibility to develop our capacities in collaboration with WHO to control international spread of diseases and other kind of health hazards as aimed by IHR. The three pillars the action plan built upon reflects the needs very well. I'd like to underline that our region has an advantageous position in terms of existing capacities of its member states. However, there's always room for development in national plans and policies, laboratory capacities, surveillance, and risk communication as stated in Strategic Pillar 1. Our regional office successfully supports member states in the implementation of Strategic Pillar 3 of the Action Plan on measuring progress and promoting accountability. The office provides technical assistance for member states of the region when necessary. In this regard, I'd like to thank the hard-working team of the regional office. I believe that we have to work on further development of event management in our region, as emphasized in Pillar 2, particularly improvement of emergency preparedness and response operations is a never-ending process which needs to be updated regularly. I also would like to emphasize the usefulness and necessity of simulation exercises in assessing the actual functioning of alert and response elements of public health preparedness and response. Finally, Turkey is working closely with WHO regional offices on preparedness and capacity building. Considering the crucial role of IHR for international public health, we are eager to accelerate the sustainable implementation of IHR through the action plan. Turkey supports the adoption of the draft resolution. Thank you, Chair.
Thank you, Turkey. Delegate of Finland, please, followed by Germany.
Thank you, Mr. Chair. We thank the Regional Office for this draft action plan to improve public health preparedness and response in the WHO Euro region, based on the Global Strategy Plan 2018-23. Adopted by the World Health Assembly in May 2018. We welcome and support the work done by the Regional Office towards strengthening and maintaining adequate core capacities, event management, and to measure progress in the WHO European region and its member states to accelerate implementation of international health regulations. In line with the WHO efforts, European Union will start in 2019 a joint action of 32 member states and partner countries to strengthen national and regional public health preparedness and IHR implementation. A joint action is a regional EU and member state co-funded activity, and the national IHR focal point, the Finnish National Institute for Health and Welfare, THL, will be the coordinator to lead this joint action. Aim of this action is to promote the whole of government coordination and to facilitate cross-country cooperation in line with the WHO Euro draft action plan. Thank you.
Thank you. Please, Delegate of Germany, followed by France.
Vielen Dank, Herr Vorsitzender.
Thank you, Chair. Chair, Germany would like to begin by thanking the regional office for having developed this action plan. We welcome the fact that this action plan was elaborated in the course of a consultation process. In February this year, there was a meeting in Munich on the IHRs, and that was part of the consultation process. We agree that preparedness measures for public health emergencies have to be undertaken in a sustainable, ongoing way. We also recognize that we have to strengthen what we do on prevention and detection or identification of possible risks. This is vital if we are to achieve the goal of the best possible care for all in all circumstances. We need strategic objectives for prevention and response measures, and all of this has to dovetail with various national strategies that we have. We wish to commend the cross-cutting, cross-sectoral approach that is taken within this action plan. And we would call upon all member states to become involved in the ongoing dialogue so that we can really foster dialogue involving all stakeholders. That kind of broad dialogue is extremely important. And we'd like to highlight the fact that we have new tools available today to enhance communication for all of us, and that can be to all of our benefit. We are convinced then that new communication tools that we have will allow us to build the capacity of our region in a very fundamental way and will allow us to respond to public health emergencies more promptly in future. We support the work done by WHO then on preparedness and response to health emergencies. Our response has to be based on 3 key issues: 1, strong political support; 2, financial support; and 3, technical cooperation. That is something we can be involved in thanks to what can be done by the skills and expertise of our public health institutions. We therefore support the action plan and the resolution. Thank you.
Thank you, Germany. Please, Delegate of France, followed by Netherlands.
Merci, Monsieur.
Thank you, Chair. Chair, IHRs are a priority for France. For that reason, we would call for adoption of the action plan and the accompanying resolution at regional level. We think that it's very important that we understand exactly how WHO, Euro, and the CDC and the EU work together in order to ensure that the IHRs are implemented as well as possible, in order to pool our knowledge and expertise. And we have a great deal of knowledge and expertise that already exists within this region. We support the framework for monitoring of implementation of IHRs in all 4 respects in terms of self-evaluation, the external evaluation, review, and simulation exercises. We also encourage further support from WHO to countries who are developing national action plans. We're very much committed to the key role that has to be played by national focal points in coordination of response to public health emergencies and also in training activities. The Lyon office of WHO has a great deal of expertise in that respect, and France is delighted to say that it's going to be hosting the high-level conference on intersectoral cooperation on public health preparedness that is being organized by WHO, and that will be in Lyon on the 3rd and 4th of December. December this year. Thank you.
Thank you, Frans. I would like to ask Delegate of Netherlands, please.
Thank you, Chair. I just would like to make a short remark. I would like to thank the Secretariat for its work. IHR is the core of our global preparedness and response work. Let's be clear about that. And the action plan reflects what is needed in our region, and we fully support it. Thank you.
Thank you. Switzerland, please.
Monsieur le Président.
Thank you, Chair. Chair, Switzerland would like to thank Euro for having prepared this action plan to improve public health preparedness and response to the WHO European region. We support this regional action plan and its 3 strategic pillars, which are in line with the global programme that was adopted by the World Health Assembly this year. We also support the proposed draft resolution. We commend the progress made in Europe in implementation of the IHRs in recent years. We ourselves have boosted our capacity for implementation, and there will be a joint review of this following on from what we did at the end of 2017. We found that to be a very informative exercise indeed. We would, however, like to make a comment. We agree that through the annual self-evaluation questionnaire, information should be sent to WHO. We also believe that external joint reviews and subsequent recommendations for national action plans are a valuable and useful alternative to the annual questionnaires. This is important because it's not just reporting on the current situation that's involved, it's also a way of getting information about specific progress that has been made moving towards targeted implementation of IHRs in different situations. To have these 2 things being done in parallel does involve a great deal of expenditure of resources, and Switzerland can't do the 2 things. Now, if we're going to have this annual reporting system through the questionnaires, as suggested by WHO, and also have this other system, we are going to continue officially doing the response to the questionnaire and not continue officially with the process that relates to the joint external review. Thank you.
Thank you, Switzerland. Kyrgyzstan is... Please, Delegate of Kyrgyzstan.
Thank you, Chair. Chair, Regional Director. Kyrgyzstan considers that introduction of the IHRs is a basis for improving public health preparedness and response to public health emergencies. We therefore believe that WHO should continue to play its leading and coordinating role in ensuring implementation of the IHRs and in helping countries to respond to international health emergencies. I noted the Russian Federation's position. We actually met with the Russian Federation yesterday. We discussed the resolution that has been submitted. And it seems to me that, in fact, the issues raised by the Russian Federation were issues that can be resolved. It seemed to me that yesterday we'd actually found a certain amount of common ground and a certain amount of consensus. I respect the stance taken by all member states here, but I very much hope that by the end of this session we will have another opportunity to meet in an official consultation group and to work on the wording of this resolution. I believe we will be able to move forward and we will be able to find consensus in that way if we had a group that worked again on the text of the resolution. And I would suggest then that we do further work in that way on the resolution.
I would like to ask the delegate of Russian Federation if you can read the amendment, your version of the...
Спасибо, господин председатель.
Thank you, Chair. Chair, the initial version of this document was prepared in English, so I'm therefore going to read out my proposed amendments in English.
So the first amendment, paragraph number 7 in the preamble. The paragraph starts with confirming that member states of the WHO European region. So we suggest to leave the first and last sentence of this paragraph. Then it will read as follows. Reconfirming that member states of the WHO European region agreed that the development of the regional action plan is to be aligned with the global strategic plan. The second, in the chapter number 8, starting with recognizing that adequate protection against health threats. To add the part "and as appropriate" between words engagement and whole of society. Then the entire chapter will read as follows. Recognizing that adequate protection against health threats requires high-level political and financial commitment to address the full cycle of emergency management, including prevention, preparedness, response and recovery, supported by multilateral engagement, and, as appropriate, whole-of-society approaches and effective partnerships. Amendment number 3. In operational part, paragraph number 1. Change word adopts with welcomes with appreciation, and to delete the last part of the sentence with its 3 strategic pillars. Then the entire chapter will be read as follows. Welcomes with appreciation the action plan to improve public health preparedness and response in the WHO European region. Next amendment. Chapter 2C. To add multi-sectoral and exclude whole of society. Then the chapter will read as follows. To commit to and to take proactive multi-sectoral action in the implementation of the regional action plan, recognizing the importance of a multi-sectoral approach in improving preparedness for and response to emergencies. Next amendment. Paragraph 2E. To the end of the sentence, to add, according to IHR. So the paragraph will read as follows. To undertake systematic and repeated assessment of national capacities in order to monitor progress, identify gaps, and prioritize actions according to IHR. Next amendment. Paragraph 3A. To exclude following words, including monitoring, assessment, review and testing of national capacities for emergency preparedness and response at the request of member states. And to add, upon request of member states, the necessary to the beginning of the chapter, of the paragraph. So the entire paragraph will read as follows. To provide, upon request of member states, the necessary technical support for the implementation of the regional action plan, and being mindful of regional economic integration organization, legislation, instruments, and measures in this regard. And the last one. In the paragraph 3B, to exclude words, through partnership with relevant stakeholders, including civil society and community organizations. So the paragraph will read as follows. To advocate for, engage and mobilize resources for the implementation of the regional action plan. Thank you.
Thank you, Russian Federation. As I see, there are not the other requests from the member states. Then I will move to the non-state actors. And I would like to ask International Federation of Medical Students Association and the European Medical Students Association joint statement.
Honorable Chair, distinguished delegates, the International Federation of Medical Students Association and the European Medical Students Association applaud the efforts of WHO in strengthening national and regional capacities to effectively prevent, prepare for, detect and respond to public health threats and to provide support to affected countries when necessary. We regret the thousands of deaths and immeasurable suffering caused by emerging infectious diseases outbreaks, the risk of which remains a major public health concern and will have many long-term impacts on the societies and economies of the affected countries. This is why we believe strong action is required to improve preparedness and respond better to future outbreaks. Emerging infectious diseases are affecting nations across the world that have demonstrated their capacity to overload existing healthcare systems in diverse circumstances. As the next generation of health professionals, we believe that an approach to strengthen health systems should include the following principles. Firstly, lead coordination of the health cluster in disaster response for future outbreaks, whilst including all relevant international, governmental, non-governmental and local stakeholders. Secondly, urge member states to include stakeholders in their response to emergencies, as well as advocate for joint One Health efforts to strengthen preparedness. Lastly, encourage member states to provide governments with the technical advice and political push to continue with national efforts to achieve universal health coverage. It is only by taking coordinated steps, open sharing of knowledge, technologies and materials that we can truly push forward the international health regulations and optimize secure global public health. Thank you.
Thank you. I have reached now the end of my speakers list. Dr. Emiroglu, would you like to respond to the comments and questions raised?
Thank you very much, Executive President, and thanks to the Member States and the civil society for taking the floor and giving us your guidance. I hear that there is a strong support and commitment from many Member States to improve the public health preparedness and response within the European region, and as indicated in the regional action plan, that I want to underline once more that this has been a joint product as a result of broad consultation in a very inclusive and transparent way. And we tried to really get all your inputs to be able to reflect the European realities. So a few questions and comments that I would like to answer in groups, but let me tell Serbia that with the vector control, we're going to have it tomorrow. If you allow me, we will have more discussions hopefully tomorrow. One of the areas I want to